So it's been 35 minutes, and I've been looking at my laptop there, and this is how it looks once it comes off. So that's basically frozen fatty tissue there. It's swollen. When you feel it, it feels frozen. The skin's red. The redness goes away over an hour or two. Mm-hmm. And Tricia's just wiping off that gelatin that we had shown you earlier. And then she's just going to kind of massage out the frozen fatty tissue.
Just helps to break down the fat cells to enhance the results of cool sculpting. And it's just for 2 minutes, and it's the only time that the area needs to be massaged.
So this is, again, my third treatment. I actually think this is the most comfortable treatment. They've shortened the time of it, and I think it's a bit colder, right? Mm-hmm. And I think Tricia mentioned this. Is it more vacuum or less vacuum?
Less vacuum.
Less vacuum. So it actually was more comfortable than my previous treatments. My last treatment, I think, was a couple of years ago. So they continually modify and update the treatments. And this part actually this can be a little uncomfortable. This isn't bad. It was worse in the past. So this is how it looks afterwards. So it'll be a little swollen. If I were to need a second treatment, we can do that in a couple of months. Mm-hmm. The final result, that takes 3 to 6 months. Okay. It'll be a little swollen, for a few weeks. Again, it's mild, nothing that nobody would notice. Certainly not clothing or anything. And again, this redness is going to go away here pretty quickly. And my plan is to get right back to work. Now we're going to treat this side, which will be the same process as the left side. And I think in 45 minutes or an hour or so, we're going to resume having surgery. So it's got a pretty quick recovery. What else, Tricia? What else did we cover?
Yep, and usually we bring the patients back in 60 to 90 days. They can have their second treatment, or if we're just going to follow up with them after the treatment, we will have them come back in 90 days to take their after photos to compare them to the before photos. And then just reassess them to see if further treatments are required, or a lot of times they would like to treat new areas.
Good.